But let's speak now to Aontú leader and founder Peadar Tóibín TD from Meath West, who's on the line. And a very good morning to you, and thank you indeed for joining us on the programme this morning. There's no doubt a lot is being done, and everything that can be done is being done to try and stop this crisis. But it's a crisis of the government's own making, you would contend.
Yeah, it's an incredible situation. In many ways, when you listen to the government, you feel that the government are nearly blaming people for getting sick, and that's causing the crisis within the health service. The cause of the crisis in the health service is the lack of capacity. We have a health system that's built for 3.5 million people, and not the 5.5 million people now that live in the state. We have a health service that went through 10 years just after the crash of having its services cut, which has had a massive, significant reduction in the level of capacity just in the last while. And we have a health service that have gone through closures. There's 8 A&Es have been closed in this state in the last 15 years. Now, if you close 8 A&Es then in 15 years and then find that all the A&Es are rammed, that they're jammed, that they're stuffed, logic will tell you maybe you close too many A&Es, and that's a part of the problem in relation to this. And it was really interesting. Yesterday, Professor Declan Lyons, who's a consultant physician and geriatrician in Limerick Hospital, who himself, I believe, was a clinical director of Limerick University Hospital, he stated on live radio, which what we have been stating for a long period of time, he stated in 2009 the closure of the A&Es in Ennis, Nina and St. John's Hospital were wrong. And they have, in part, significantly caused the pressure, the chaos that's happening in Limerick University Hospital at the moment. And the fact that senior clinicians are waking up to this 10 years later, but still the HSE is involved in a process of closing A&Es, it's still absolutely mind-bending from the perspective of a citizen in this country.
Okay. It's a little bit more than 10 years, though, isn't it?
It's been 15 years since the likes of Nina and Ennis and St. John's Hospital and even Monaghan and Dundalk, those A&Es lost their A&Es. And as a result, that's put the pressure on the rest of the section. And that's leading to, and it's very important to say this, that's leading to the overcrowding. It's leading to patients being crammed on trolleys side by side in A&Es. It's leading to not enough space for doctors and nurses to carry out, the delivery of diagnostics and treatment on those patients. It allows for the fertilization of contagious illness in those small spaces. And it's leading to deaths. There's about 360 people who are dying every year in this state due to hospital overcrowding. And even I've been looking at the figures, and I've got a parliamentary question response back on this. There was 105,000 adverse incidents last year in the healthcare system. So that is situations where patients in the healthcare system had damage done to them, not by accident, in the healthcare system. And that's leading to, in some cases, death, in some cases, people being disabled, etc. And we have a situation where the state has paid out €2 billion in compensation for those adverse incidents in a short period of time. That money should have gone into the creation of new staff, new capacity, etc., the delivery of proper health services, rather than see this damage being done, being compensated for it in the end.
Right, well, there's nearly 1,000 people on trolleys yesterday, and what that means is that those people need to be treated in hospital. They're so sick that they should be in hospital, being cared for on a ward in a hospital bed. They've been admitted to the hospital by the doctors, but there just isn't a bed available for them on a ward in the hospital that they're attending, and there's almost 1,000 people in that situation. Can I quote a government minister on this who said that the bottom line is that no one, particularly no older person, should sleep overnight on a trolley in a corridor. The same minister said that every resource would be prioritised and every action needed would be taken to improve care for patients at A&E. People who need to be admitted will have beds, not trolleys, and the basics for human dignity. That will be put in place in the coming months, this minister said, because anything less than that would be unacceptable to the public, not acceptable to the minister and not acceptable to the HSE. Now, that's a statement from the Minister for Health, who declared a national emergency in hospitals, emergency departments, almost 20 years ago. In 2006, Mary Harney made those comments when she was the Minister for Health. She made those comments because of the public outcry when there was 495 people on trolleys, and that compares to double that figure yesterday, almost 1,000 on trolleys. It's an incredible situation.
Yeah, so there's a couple of points to that. I believe there's a duplicity inherent in the government's approach to this. So yes, the likes of Mary Harney say exactly what James Riley, exactly what Stephen Donnelly say. The language is nearly exactly the same over the period of those 20 years. Yet they carry out policies which lead directly to this situation. So they're saying one thing to ameliorate the anger that's in society, but they're still following exactly the same policy platform which is causing the damage. The second thing is, in relation to Minister Donnelly saying that they're going to get every single resource in place to make sure these problems don't happen. Well, the situation in Limerick was particularly kicked off because Shannon Doc, which is its out-of-hours doctor on call service there, literally was grinding to a halt, nearly fell apart just before Christmas. It couldn't take patients. And as a result, patients then were sent into A&E to be dealt with. And that's, Shannon Doc is not on its own in relation to this. In Meath and in Louth at the moment, there are many evenings and nights where there's no doctor on call, where people have to travel 80, 90 kilometres to a doctor on call. So those people are going to go into A&Es instead. Step down. Right now there's about 600 patients in hospitals in Ireland that are clinically discharged. That means the doctor has said, we can do no more for you. You should be either at home or in some other part of the health service to get treatment that can be delivered there. And yet the home care packages are not in place. The pathways into other health service elements are not in place. So those clinically discharged patients can't leave those hospitals. Now that's about 600. If you take the 600 away from the 900...
And that's because there isn't a home care service available for them, or there isn't a nursing home space available for them, or a step-down bed available for them, but they shouldn't be in hospital.
That's it. And that's two-thirds of the people who are on trolleys.
That's not acceptable. That's not...
Absolutely.
It's not acceptable. And 20 years ago it wasn't acceptable. Let me just run over that line that the Minister in 2006 said, not acceptable to the public, not acceptable to the Minister, and not acceptable to the HSE. In 2007, I take it wasn't acceptable to the public, acceptable to the unacceptable to the Minister, and unacceptable to the HSE. In 2008, I imagine it was the same. And I imagine that come January of 2024, it won't be something that is acceptable to the public. It won't be acceptable to the Minister, and it won't be acceptable to the HSE. But will it be the situation, acceptable or otherwise?
It will be the situation. And I'll tell you why. Because we have witnessed, especially in this region, over the last number of months, a titanic battle between the HSE and the Minister, where the HSE is simply ruling the roost and doing what it wants to do, and while at the same time the Minister is, has his hands tied and is finding it very difficult to push back and stop the HSE. An incredible issue that I was reading yesterday, researching about this yesterday, was that we know there's a major crisis in GP access, and again, lack of GP access leads to overcrowding in A&Es, because if you can't get on a GP list, number one, you have to go to an A&E, and if you can't get an appointment with a GP for 2 weeks, you have to go to the A&E. The HSE does not know how many people are waiting for to get onto a GP list in this country. They don't analyse, they don't record or identify the amount of people who can't get a GP appointment or how long they're waiting. But that's the key building block of this. The GP is the first door into the health service in this country, and if the first door is blocked, well, then people are pushed into the A&E. So how do you fix the A&E overcrowding if you can't get the GP stuff right? And secondly, the Minister mentions, that all private health service capacity will be put into place. Right now, there's no centralised system for private healthcare capacity to be utilised within the public health system. So it's done on an ad hoc basis, here and there, but there's no, group of people, 2 or 3 or 4 people, who are saying, okay, here's capacity, here's an A&E that's private A&E, but it shuts in the weekend or it closes at 8 o'clock in the evening. Let's get that ramped up overnight, etc. And if the Minister meant business, he would be pushing for that as well.
OK, well, the government might argue otherwise, but governments have been arguing otherwise for 20 years. And this problem dates back to before Mary Harney declared the problems in emergency departments a national emergency that had to be tackled as a priority. And 20 years on, if you like, the problem is twice as bad. But over the years, we've heard the government say that they'll respond by dealing with those discharge problems, making more nursing home beds available, more home care hours available, step-down beds and so on. We've heard about the GPs, primary care centres and all that sort of thing. More beds will be brought online in hospitals, more staff, consultants will work different hours, new contracts and all of that sort of thing. But here we are 20 years on and the problem is twice as bad. Maybe you bear with me for a moment and we'll hear a little bit more from the Minister, because the government will say that they've invested an awful lot, and in fairness they have invested an awful lot into the health service. But why does the problem continue?
People have asked why the pressures that we're seeing now. We know that there has been an unprecedented level of investment by government since COVID arrived. We have about 950 extra hospital beds, a lot of extra ICU capacity, hundreds of extra community beds, over 16,000 more healthcare professionals working within the HSE. So we've seen a permanent expansion in our public health system over the last few years that is unprecedented. And so people are asking, well then why are we still seeing these pressures? What the HSC are telling me and what the treating clinicians in the emergency departments are saying is they're still dealing with COVID, obviously. There's still a lot of people coming into hospital with COVID. There have to be separate pathways for COVID patients. There are infection prevention and control measures around COVID patients that mean that more beds, or less beds rather, become available when COVID patients are coming in. We've had a big wave of RSV. The latest figures show that is falling, and we want to see that continue to fall. But what I'm hearing this week, what I was hearing last week, what I'm hearing here today and then in Vincent's today, is that the flu wave is very severe. It's hit earlier than it normally would, and so we have this perfect storm of RSV, the flu, and COVID, obviously, as well as all of the normal pressures. And that has absorbed the significant additional capacity that has been put into the system.
That's the Minister, Stephen Donnelly, explaining why there's a problem this year. And in fairness to the Minister, Peadar Tóibín, it's not a uniquely Irish problem. This perfect storm that he talks about is being felt across Europe, isn't it? The combination of flu, RSV and COVID.
Like, again, what we have is the Minister saying the reason why hospitals are full is because people keep getting sick. If people would just have a little bit of cop on and stop getting sick, there'd be no problem with the Minister's hospital system. What kind of nonsense is that? The idea that the capacity crisis in the hospital system is due to the fact that pesky people keep getting sick is absolutely wrong. The reason there's a capacity problem in the hospital system is because the government have gutted it. Now, I listened to the Minister saying that we've had an unprecedented increase in the number of hospital beds, ICU beds, etc. Now, he takes a baseline of at the bottom of just after the crash. So when the government literally had gutted the health service, it did go down to a really low level, and yes, they have increased the number of beds, etc., since then, marginally. But in 2008, before the crash, there were 21,000 hospital beds in this state. Now, today, there are 14,412. So when the Minister, when people listen to the Minister or the Taoiseach say we've invested massively, figures are up, they're only talking about figures are up from the very bottom of the trough after the crash.
Just repeat those figures again, if you would.
So in 2008, there were 21,000 hospital beds. In 2020, there were 14,412 hospital beds in the state. And that's the population is easily increased by over 200,000 people in that period of time.
So that's 7,000 fewer beds.
7,000 fewer beds than there was just before the crash. When the Minister's quoting that there's been an increase in hospital beds, and they do this all of the time, and it's really sneaky. They're quoting from about 2014 when literally we were on the floor in capacity in the state after all the cutbacks, after we had the troika in this country. So it is deeply disingenuous to say that we have an increased strength health service We simply don't. We don't have enough. And the other point I will say to you as well, there is a lot of money going into the health service, for absolute sure. But that money is not being focused on frontline delivery of diagnostics, engagements, consultations, operations or treatments. That money is getting lost in layers of management. And we believe what needs to happen is hospitals and the health service should get paid on the number of engagements they have with patients. Every time there's an operation, every time there's a consultation, every time there's a diagnosis or a treatment, well, then you can get paid on that basis. In the same way that a small business only gets paid on the basis of value it brings to actual customers, the HSE should only get paid on the basis of value it brings to actual patients. Because what happens is in this country is we see in hospitals will actually close operations down for 3 or 4 months over the winter. And that means that, lists are getting longer, people are waiting longer, but the hospital is still getting paid the same. The money is still coming through the same. But if you turned around to the hospital and said, no, you're only getting paid if you actually continue delivering in those operations, then you would see the reduction in the level of people on the waiting list. There are 850,000 people in this country currently waiting for a operation or a consultation in hospitals, and that's an incredible situation.
Well, there's no doubt about it. It's a completely incredulous situation because we're talking about a situation where the problem has doubled over 20 years or thereabouts when we were told it was a national emergency and it had to be tackled as a matter of priority. And I'm sure you'll agree that people shouldn't go to the emergency department or to hospital if they don't need to. But about 1,000 people went yesterday and they needed to be in hospital because the doctor said they needed hospital care, but there just wasn't enough room in the hospitals for them.
Absolutely. And what's going to happen with many of those people is their diagnosis will be delayed because they're waiting so long to get in, maybe 12, 14, 16 hours to get treatment. Their actual treatment will be delayed as well. And there is a direct correlation between delayed diagnosis, delayed treatment, and the outcomes for patients. And studies have been done in Britain in relation to this, and they have shown that there's an increase in mortality, in death, as a result of people waiting significant times to get seen and treated in a...
The consequences of a stroke going untreated is pretty unbelievable if somebody's in the hospital waiting
Absolutely,
for treatment.
And we saw that very, very sad case where that young woman in Limerick Hospital waited, I think, 16 hours to be seen, and she lost her life. So this is a life and death situation. This is a threat to health. It's a threat to people's lives, and it should be treated as such.
All right.
And unless the government change tack on this, and one other point I just want to say on this, the government, they tell you about what they've invested, etc. When it comes to the election, Fine Gael will fight that election on what kind of taxes it can reduce for people. So in this country, we have an argument every election about delivering European health services, but the government say they'll do it on US taxes. That is the deep inherent lie at the bottom of this problem. You can't do both. You can't have a US tax system and a European health service.
Boston or Berlin, it's up to people to choose, is an argument that's been going on for 20 years for that matter. We leave it there for the moment, though. Thank you indeed for joining us on the programme today. That's the leader and founder of the Aontú party, Peadar Tóibín, who's a TD for Meath West.